Welcome to ABP Desam Health Conclave 2025.
The topic for this session stands Fertility Struggles to Fragile First Cries, India's Urban Crisis. Let's take a look and let's dwell deep into this topic. I would request our moderator, Chahat Jain, to please join us on the stage. Let's welcome her with a round of applause, everybody. And we now invite our speaker, Dr. Suresh Kumar Panuganti, Pediatrics, Yashoda Hospital, Hyderabad, and Dr. Sarada M, Gynecologist, Laparoscopic and Robotic Surgeon, Yashoda Hospitals, Hyderabad. So we have our leading doctors today from Yashoda Hospital joining us, who will be taking this topic forward with our moderator, Chahat. Let's dwell into the session and let's give them a round of applause, please.
Welcome, doctors. But before I start the session, can I please request everybody who's standing at the back to take their coffee and their tea and come and sit over here? Can I please request all of you? So before I start my session, also I would like to share some alarming facts that a lot of us might not be knowing, but it is actually alarming. And it's not alarming just for us as individuals, but also for our country. So in the year 2025, which means the present year, the total fertility rate, which is also called as the TFR, it has declined to 1.9 children per woman, which was earlier 2.1. So that's a huge decline. You know, when we talk about infertility, about 15 to 20% of young couples are struggling to conceive. IVF is rising thanks to the medical education. Okay. But again, you know, most of the IVF patients are below the age of 35, and that's actually alarming. So I would like to start with you, Dr. Sarada. What is the young generation? What is the one thing that the young generation is probably doing wrong that is actually contributing to such alarming numbers? Or is it not something that people are doing deliberately, or something that is maybe things are changed around us, maybe yes, what we are eating, or pollution? What is actually contributing to this alarming number?
Yes, Chahat, that's definitely a very good question, and we do come across a lot of people coming to our OPD asking these questions. The parents are they're very happy that children have achieved a very great level in their careers. They're doing good, much good, trying out their dreams. But the family part, they're not able to plan a family because definitely things have changed. A lot of urbanization. Our career priorities are different. We want to settle, then plan a baby. Initially, it was not like that. You get married, study with your age. Age is what they used to consider. You should get married by this age.
You mean to say.
But now, delayed marriages, late marriages, and even after marriage, people want to wait. Nowadays, with a lot of social media coming up with egg freezing. So options are more for women to have their eggs with them. So things are changing.
Okay. Doctor, coming to you, you know, it's not just, it's not a women's problem, it's not just couples' problem, you know. We have seen that. I just wanted to ask that, is there any correlation between infertility and the kind of rare diseases we are seeing, the surge of rare diseases in newborn babies? Is there any correlation between the two?
Yeah, absolutely. Nutrition, when we are talking about a pregnant woman, the nutrition begins from the childhood itself. The feed the child, the newborn baby or an infant, or when the weaning was started, what kind of foods were introduced. And thanks to social media, now we are seeing a lot of obesity. Previously, we used to see malnutrition, that is MAL, that is undernutrition. Now we are seeing on the other end, malnutrition, MALL, because of all these ultra-processed foods and all. So we talk about junks. It's not the junk food what you're talking about, JUNCS. That is junk food, ultra-processed food, nutritionally inappropriate food, carbonated or caffeinated drinks, sugar and sweetened drinks. All of this lead to an unhealthy lifestyle, obesity, and then some of these are associated with endocrine disorders as well, and subsequently they end up getting married late, and then they end up going into this IVF and other things like that.
Dr. Shada, you mentioned that there are pretty good lifestyle issues that especially women are facing these days.
Yes.
So do you think, can you name some, because I know that, people are indulged in activities they are not meant to be, and there is no proper awareness, especially at the school level at early ages, that that you should not be doing this, you should not be eating that. So do you think that these lifestyle changes are actually contributing much to this rate?
Definitely, Chahat. See, our society has changed. We
Right.
want our kids to study well. So usually that adolescence starts, girl is in her 12th class, 12 years, and then it goes on till 18 years. That's the time when they are in their 9th, 10th grades, plus 11th, 12th, intergrades. So there's a lot of pressure on them that they have to get into some good colleges, IITs, NEET exams, so many these
Right.
things. So they are studying. I'm surprised. Kids come and tell me they study till night 11, 12. 8th class kid. I hardly remember studying in 8th class. So things are changing. They are made to study from morning 6 till night 11, 12. Hardly time to sleep. So many workshops, so many exams. So there that lifestyle is changed from the adolescent age. So
Apart from the practices, they
Yes.
should not be indulging in
yes, so they're not playing.
harmful things maybe.
They're not playing at all. No play. They're just sitting and studying, which is very alarming.
So basically, you mean to say that it all starts at very early age.
Yes.
Doctor, coming back to you, earlier you mentioned that, we used to hear about the term malnutrition, but it has completely gone, and we are now talking about obesity. We also hear a lot of kids having sugar and diabetes at very early age. Isn't it very alarming, like somebody is just 5 or 6 and they have diabetes already?
Absolutely. Earlier, we used to talk that South India is the hub of diabetes for adults.
Right.
Now, overall, India has become hub for type 1 diabetes. That
That's
is
true.
diabetes in childhood.
Yeah.
We see children as young as 1 year. I'm not
year.
talking about genetics. If you're talking about congenital or neonatal diabetes, yes, we do see in neonatal period. But as, I have nearly 120 children who are type 1 diabetics under my regular follow-up. And the youngest one was 11 months.
Oh my God.
Surprisingly, both parents do not have diabetes. You
So
cannot
what
blame
could have
genes
been the
for
reason?
everything. We had our earlier colleague from Map My Genome. They could prove that it is not genetic. So yet, there are a lot of children who are coming with diabetes. What we need to realize is it is going to change the lifestyle of entire family, because it
Yes,
is not
right.
disease of the child alone. Child needs to take insulin for lifelong.
And the other generations would be following.
It includes financial, emotional, all sorts of aspects when a child is diagnosed with diabetes.
Doctor, he just mentioned the word financial. When we talk about infertility, it also comes at a huge cost.
Yes.
So, medical sciences have improved, it has developed. But do you think that since the numbers are alarming,
Yes.
we also say that around more than 24.7 million couples in India are struggling to conceive. So it's a huge number.
Yes.
These people might be sitting in tier 2, tier 3 villages, urban cities, anywhere.
Yes.
So do you think it is our responsibility, the medical authorities' responsibility, to make it more accessible and affordable?
Definitely. So we have a lot of government hospitals, and government is thinking. So we have some IVF facilities in the government hospitals. So there are some deemed hospitals like AIMS, NIMS. So NIMS doesn't have an IVF center, but AIMS definitely is looking at it. And a lot of medical colleges, especially in Telangana, government medical colleges, they are trying to establish an IVF unit along with the gynecology unit in the college. So that could help out many women who are financially, they cannot afford.
And also, how about spreading awareness and breaking the taboo? Because
Yes.
still a lot of people are, shy to discuss their issues. Forget doctors, they can't even discuss the issues amongst their peers. So we need to also promote this health literacy amongst people as well.
Yes, definitely. The social media is playing a lot of role, good role. Lot of things are there now on the media, YouTube, on the news channels and all. So they are like half aware. They're not totally aware. Lot of myths are there. So maybe more information leaflets to them, small bites about their sexual health or when they should plan their pregnancies would definitely help out.
Yeah. Also, we also say that, half information is more dangerous
Yes.
than having no information. Doctor, coming back to you, we spoke about diabetes. But, if you see, a lot of newborn or a lot of children are also being born with rare diseases. It used to be like really rare a decade from now, but now children with special needs, the number of children with special needs is increasing, children with rare diseases is increasing. Again, do you think it's a lifestyle issue that maybe a bad lifestyle parents must be following that is actually genetically being transferred to the baby?
I would rephrase this and answer in two parts.
Sure.
One, probably it's not that rare. The reason why I'm saying it's not rare is we are diagnosing them more now. Some of these diseases have been existent for a long, long time, but we didn't have facilities to make a diagnosis.
Okay.
Thanks to the COVID, I would always thank to COVID for a lot of reasons, because it has raised awareness among the general public that there are some genetic tests. There
Right.
is something called PCR, and people are ready to spend on that to know the diagnosis. And coming to children with special needs, yes. Just a story, during COVID, we had a child who came to us who was talking. None of us were able to understand what he was talking, including the parents. It took 3 visits for us to understand he was speaking Korean.
What?
Both the parents are not from Korea, and lot of these younger generation will realize thanks to K-pop and Korean serials. Okay,
Oh.
child was religiously following this. He picked up that language before the mother tongue. Okay, and he was not able to communicate with parents because both parents didn't know Korean, and he was not responding to name calling. This is what we call screen time induced autism. Autism, ADHD. The awareness amongst doctors has increased, and we are making a diagnosis. And now there are a lot of developmental pediatricians who have come up, and we are able to provide therapy. These diseases were there, but definitely it's increasing, alarmingly increasing, I would say.
Doctor, similar kind of question to you. I mean, rare diseases, rare fertility issues. People usually don't know about their bodies, properly. And again, all of a sudden, they get to know that something is wrong. So, do you think that proper awareness, proper education, medical education should be given at very early stage?
Yes.
What should be our steps to make people aware?
So there are a lot of medical conditions like SLE, diabetes, women who have kidney problems. So eventually they'll have transplants, renal transplant at a young age. So even they are becoming pregnant now. So girl who had a transplant at a younger age, so they'll be on some medicines. So they are attached with some doctors for their medical condition. So it is there they should get an education that when they become pregnant, what they have to do. Can they become pregnant or not? Will pregnancy affect their medical condition? Can they survive? A lot of heart conditions are there which are not good. So the primary doctor who is taking care of them should be educating them.
Doctor, also, there's a combination of vitamins, minerals that everyone, this is for both the genders, everyone should be taking from an early age. This is not just for the fertility or for the newborn issues. This is for a well-being, like the entire well-being as well. So do you think that we don't even tell our children, tell our daughters or tell our sons that, this is a combination that you should be taking? Vitamin D, B12, vitamin C, these are actually the most common deficiencies that India is actually suffering through. And if we start taking, if not supplements, but maybe in the original form, from the young age, then we might eradicate such issues.
So we have to practice first. Maybe we should practice all those good lifestyle changes to tell them very good. And it's definitely at young age. Maybe the school teachers or when they have. So like you have said, the vitamin D, which they have to get exposed to, get good vitamin D in them, good B12.
We do see a lot of vitamin deficiencies, and they present very late. Inability to walk, inability to see, which could have been easily prevented by eating dark green leafy vegetables or going in the sun, which most of us we did as children. But now various factors do play in that. I do not blame one particular sector,
Right.
be it school or be it parents, nuclear families, be it impact of media. All of those things have led to children being deficient. Now we have to take the first step. As medical personnel, it is our responsibility to educate amongst the school children, because everything begins from there.
Right.
And when a teacher says, they tend to believe it more than when father or mother says.
Right.
Okay, and when you guys in media say, it can go to a larger population in a shorter time. So I'm very glad you guys have taken such initiative, bringing on so many different fields in medicine to public. And I'm sure you are going to publish a lot of this in the news, which will educate much more than what population we are seeing here.
Doctor, I would like to ask you the one final question. You know, how many parents are coming to you and talking about the mental issues or the mental conditions their children are going through? Because, you know, mental health is also an alarming thing that is becoming very common in very young children. Like, you would see anxiety issues or, you know, pre-depressional issues in young children as young as 7, 8 or 10.
It is definitely alarming. I would quote Deepika Padukone to say, it is normal to be not normal.
Right.
Okay, and don't hesitate to come out and speak to your parents or teachers or doctors or your friends when you are not feeling okay. Don't think that people will judge. Gone are the days. Now so many celebrities have come out saying in open that yes, they have gone through depression or mental health issues. Now we are seeing a lot of children coming up, opening up. We have adolescent clinics where a lot of adolescents come and talk. One thing, we have to make sure that they feel safe to open up. They feel safe to feel that we are non-judgmental. That is when they come up.
Doctor, same question for you, especially
Yes.
for women, especially for such couples
Yes.
whom we are talking about, whom we have shared these numbers. Again, opening up. Do you think they are still hesitating? That is actually delaying their treatments, and how is it contributing?
Lot of hesitation is there, especially they don't want, even with the partners, when the wife doesn't want to tell, the husband doesn't want to tell. Every level the hesitation is there. So that comes through a lot of awareness.
So as a doctor, what would you like to tell them? Maybe a message from your side.
Yeah, so speak up, speak. Whatever you feel, maybe you can speak first. Let the other person understand, is it right or wrong? The doctor or somebody who knows what's happening should
Right.
know.
And only then you people would be able to help.
Yeah.
Yeah, in fact, we have a program which we do for young doctors in our hospital, because
Great.
we have a lot of postgraduates studying in. Every year we do a program asking them to open up. We form small groups, let them open up, because even doctors, as doctors, sometimes we go through stress, we go through
Right,
depression.
correct.
So if we are okay, then we can make sure others are okay.
Correct. Well, thank you so much, doctors,
Thank
for
you.
speaking up, for opening up. And I hope that now people know that it's okay to talk, okay to open up. And again, if you have any queries, if you have any questions, doctor are still with us, and you can probably take this up later. Thank you so much, doctors, for
Thank
being
you.
here.
Thank you, Chahat.
Thank you so much, Chahat, for coming up with some spectacular questions on the given topic. And I would like to thank Dr. Suresh Kumar and Dr. Sarada for sharing their views. Requesting Mr. Sunil Goswami, Editor, Digital Videos, ABP Network, to kindly step forward to the stage and felicitate the speakers here with us. Requesting Mr. Sunil Goswami to kindly join us. Let's give him a huge round of applause, please. Thank you so much once again, ladies and gentlemen. Let's cheer up for our speakers here with us for giving us some great knowledge on the topic which is mentioned. Fertility struggles to fragile first cries, India's urban crisis, discussing and celebrating every moment, coming up with some suggestions for a greater good in the future. Thank you so much, Chahat.